Mr. Chairman, I appreciate it, and I thank the panel for their testimony. Thank you for all these great suggestions. What do you think is a realistic time frame for the large-scale transformations that the Commission's report calls for, assuming that the VA is already implementing some of the recommendations they claim they are making? When do you think veterans should expect to see meaningful change in the care they are receiving in terms of quality and access?
I think realistically we're looking at a 5 to 10 year transformation process. But I also think that anytime you go through that, you're looking for those early wins, those things that veterans can see quickly that improve their patient care experience. So there are some things, particularly in the area of technology and certainly just customer service aspects that can be improved very quickly to help veterans feel more confident in that change process.
Very good. Dr. Cosgrove.
Yeah, can I just add that I had experience with changing the culture of the Cleveland Clinic, and it took me 5 years in an organization that was only 80,000 individuals, and something that is as large as the VA, and I think it's going to take even longer.
Thank you. Again, well, building on that, what benchmarks should we be looking for as the VA implements these recommendations, and do you believe the VA has the capability and foresight to track these relevant data?
Well, I think much like Dr. Cosgrove does at the Cleveland Clinic and we do at Henry Ford, we have a balanced scorecard, if you will, that provides data on a very regular, frequent basis that focuses on our patient engagement scores, our employee engagement, the clinical quality outcomes, all of the metrics that Dr. Cosgrove referenced that are comparable to the private sector should be available, I think, in a transparent way for people to assess the quality as well as the service provided in each VA facility. So I think that level of transparency and having a scorecard that focuses on regular accountable results is very critical in this process.
For example, we report almost 100 quality metrics to the federal government on an annual basis. And in fact, we have quarterly scorecard meetings with all of our department heads going over all of these the metrics, and I think you have to be completely data-driven metric organization in order to achieve these transformations.
Thank you. Understanding that not just one solution will solve all the agency's shortfalls. However, if you had to identify the biggest problem, what would that be affecting the VA health system, and what is the solution to that problem?
You know,
the single biggest problem. I
think all of us felt that this truly is a systems-oriented approach, that many of the recommendations are interdependent. But if I were to put one on the table, I'd talk about leadership sustainability, because it is virtually impossible. I mean, Toby's been at the Cleveland Clinic how many years?
13.
Yeah, and both of us have served in CEO roles at 13 years in our organizations. When you have turnover in the undersecretary position every couple of years, it's very difficult to sustain change. And I think that really is holding back the kind of transformative work that potentially could happen and obviously needs to happen.
I think.
Do you agree, Doctor?
Well, I would say that it's one thing that you can do rapidly that will change the organization, and that's the electronic medical record. I mean, that can be done in a short period of time. The rest of the transformation is going to be much longer.
All right. Thank you very much. I yield back, Mr. Chairman.
Ms. Custer.